and good evening, New Skin leaders. How is everyone today? Wait, I cannot hear you guys. If you can hear me, type 555 in the chat section so I can see that everyone is doing great. Well, I believe it's not too late for me to wish everyone 恭喜发财，新年快乐. My name is Azme and I will be your host for tonight. Let's reset for 2022 together. I believe that everyone here are excited for our Edgelog Reset preview in March, am I right? If you are, do give me thumbs up in this comment section. And of course, I hope that everyone is all geared up to reset yourself to welcome this year 2022, the years of Tiger. Powered by Purple is the tagline of this product, already indicates the product performance. Edgelog Reset Soft Gel has been through 7 years of research and developed that includes the exclusive New Skin anthocyanin research and is backed by Edgelog Science. This targets the core body internal biochemical processes. With the confidence in New Skin products, Edgelog Reset Soft Gel has also won the ITEX 2021 Gold Award under the Medical and Health category. To start this off, let us introduce Vice President Market Operation New Skin Malaysia and Brunei, Henrik Wong, for his opening remark.
Good evening and hello New Skin friends and family. How are you all doing? I hope all of you are doing well and give me 5 if you can hear me. Thank you. Now Chinese New Year has just ended 2 days ago, and since we are still at the first lunar month, I would like to take this opportunity to wish all of you 恭喜发财. Okay, may the roaring tiger brings everyone good health, happiness and prosperity, and reset our mind to achieve goals, bring us positivity and courage as we reset 2022 together. Now, anyone knows how many days more before the Reset Brand Representative Review or ORS or LTO? Anyone knows? Well, we are 21 days or exactly 3 weeks away. Okay, now have all of you started preparing your team for the Edgelog Reset Review? Give me 5 if you have. Yes, as Azmi just shared just now, this product was produced after 7 years of research through our 6S quality process. In Southeast Asia, this product is known as Edgelog Reset, while in other regions, it is known as Edgelog Meta. Now, over the past few months, we have arranged a number of sessions and learned a lot from Dr. Joe and Dr. Mark about the science behind Edgelog Reset and how it is suitable for today's hectic way of living, as well as help with the effect of our modern lifestyle combined with healthy eating, regular exercise, and better sleep. And we have received overwhelming response of the successful Edgelog Reset preview from Southeast Asia market, from Thailand, from Vietnam, from Philippines, and from Singapore. And all the markets sold out during their brand representative preview last year. And we also received overwhelming response from other markets such as Taiwan and Hong Kong. And now it is our time. Okay, I'm really excited. How about you? Can you give me 5 if you are? There are 3 more cycles to develop brand representatives to qualify for this preview. Leverage on this opportunity and all the programs we have prepared for you in 2022 to build the biggest growth for your organization. Don't miss this opportunity. Okay, let's reset for 2022 together. Let's go Melbourne. Let's go double. Thank you.
Thank you, Hendrix. As usual, a powerful sharing by our Vice President. Let's give another round of virtual clap for Hendrix. So, are you guys ready to reset 2022 together? If yes, please give some love emoji. Yeah, I need more love emoji. Oh my, I received so much love today. And I'm very sure that all of you are excited for this product, right? So, without further ado, let's kickstart this first agenda of the day. Today, we are honored to have specially invited speaker, Dr. Saiful Bahari Kassim, endocrinologist and diabetologist. He has qualified with honours in multiple specialties in his field since 1997 from National University of Ireland, Galway. Today, he's going to share with us on the topic of cardiometabolic health. Should you worry about it? Should we? So if you are excited as me to learn more about metabolic health, please show some thumbs up emoji in our chat section now. Wow, I can see that everyone ready and excited. Without further ado, let us welcome Dr. Saiful for his sharing.
A very good day to you all. My name is Saiful Kassim. I'm one of the consultant endocrinologists working in Gleneagles Hospital, Kuala Lumpur, and it's a pleasure to be able to do this talk, and I thank you very much to Nu Skin to have kindly asked me to do this talk and given me this opportunity as well to illuminate you, our audience, regarding other interesting, what I would call end organ pandemic facing our nation. I would call this one as the metabolic health of the nation, and I'll explain that later in the talk. Now, I will also expand specifically what is metabolic health, or metabolic syndrome as we would call it in the generic medical world. And what is interesting is that there's so many spheres to this, so many meaning behind the word metabolic health or metabolic syndrome. Weight loss per se requires talking about a huge energy deficit, and of course that's where this very low calorie diet or restricted energy diet approach had come along to see, for example, whether we can reduce the conglomerate parts of metabolic syndrome, such as high blood sugar or hyperglycemia, or high carbohydrate food, or load that we take in our food as well. I'm going to talk about some structured multidisciplinary approach, which is effective for the management of all the metabolic syndrome defects, such as the weight, blood pressure, lipid control, and sugar control. As a sort of a foundation behind this, my colleagues and I, when I was the head of department of endocrinology in Causeway Hospital in the UK, we pioneered a program called the Motivate program, and this was very useful in aiding behavior, especially the psychological aspects of weight control, which actually has shown great benefit alongside very low calorie diet, or what I call restricted energy diet, in improving all these metabolic health parameters. I mean, we're interested in metabolic health per se. I'm going to show and highlight a few things how in evidence-based medicine, which is how we practice in generic medicine, from randomized control trials translate into sort of real world life, and how things have ended up congruently to improve how we approach metabolic syndrome management per se. Talking about the world as such, I think we have moved forward in terms of our evolution per se, as you can see from the slide, from how we were as primates and moving on towards the 21st century, where we've become a lot more obese, and as you can see in the picture, we've moved from being a hunter-gatherer towards more sedentary humans sitting on a couch and not doing very much and drinking our Coca-Cola, and this is the problem. These are the shape of things to coming forward. A lot of our patients that we see in hospital currently anyway, a lot of them tend to have more prolonged stay in hospitals with worse outcomes. If you look at what's happening with COVID, for example, a lot of patients, unfortunately, the best thing when it comes moving forward is that we have to think of ways to strengthen the immune system, and how we can refocus on therapies and diet that can improve these metabolic parameters. I think it's important that it means improving our vegetable intake, our fruit intake. I mean, looking at kiwis, for example, legume intake, fish, grains, nuts, unsaturated fats, such as olive oil et al. What does that really mean? I think it's important to think about simple changes in our lifestyle, sticking to a good sleep pattern of at least 6 hours, which is also central to metabolic health. And there's a lot of significant studies have shown that how much sleep exerts an influence over weight and immune function. And this is us moving forward as a human evolutionary species, as you can see here. In our world right now, we all know that we don't get enough sleep. Most of us are glued to our little electronic devices, our iPhones and our iPads, our computers, such that we are so stuck to that our sleep span is limited. And when that happens, if you have less than 6 hours of sleep, you have an increase in what we would call your hunger hormone or your ghrelin, and a reduction in your fullness hormone, which is your leptin, which leads to more weight gain, which worsens one's metabolic health parameters per se. So what is really metabolic health? And I think to start out, let's define what we can mean by this metabolic health per se. And it's much more than just metabolism or conversion of food to energy. Specifically, when we talk about metabolic health, it includes a full range of a lot of biochemical processes that affects every single part of your body, whether that's the cranial nervous system, the brain, whether it affects the cardiovascular system, which is your heart, whether that affects your respiratory system, which is your lung function, your gastrointestinal system, which is your gut, or your genitourinary symptoms, which is your bladder and the way it flows out into urine. So, there's a lot of things that includes indicators such as our blood pressure, blood sugar, insulin sensitivity, cholesterol, triglycerides, all affect these biochemical processes that are occurring in every cellular part of your body. And I think being metabolically healthy impacts multiple areas of health and wellness, including what I call our microbiome, especially our gut health, our gut microbiota, vital organs like our liver and heart, and our body's inflammatory response, immune response, and metabolism. So having a good metabolic health is really important. So in essence, what I would say is it's our body's biochemistry, in simplistic terms, that involves multiple organs that impacts key indicators like, as I said, the blood sugar, number one, hyperglycemia that you get in type 2 diabetes or impaired glucose tolerance, blood pressure, hypertension as a consequence, insulin sensitivity, which is really important in terms of development of hyperglycemia or high blood sugar. If you're becoming insulin resistant, obesity leads to more insulin resistance, ergo that leads to type 2 diabetes formation, and insulin resistance also associated with polycystic ovarian syndrome, which causes abnormal periods as a result. Cholesterol and triglycerides play a huge factor in terms of hypercholesterolemia, hypertriglyceridemia, increasing the risk of heart attacks and strokes by a factor 2 to 4 times if your cholesterol and triglycerides are far beyond the upper range of limit of normal. So in essence, the definition, what I would call the cardiometabolic syndrome, I think it is crucial to be identified as, we used to call this syndrome X amongst other nomenclature that we used to give it. It's a constellation of these metabolic abnormalities that confer an increased risk of heart disease, cardiovascular disease, and diabetes mellitus. So this constellation of multiple metabolic abnormalities such as obesity, type 2 diabetes, impaired glucose tolerance, or impaired fasting glycemia, or impaired high blood sugar in a fasting state, or insulin resistance, amongst others. And these metabolic abnormalities will be part of what we call cardiometabolic syndrome. Now, there are other risk factors like high cholesterol, which I talked about earlier, high triglycerides, high blood pressure. They all play a significant role in this development of syndrome X or cardiometabolic syndrome. Now, what's not much highlighted is the fact that a very low HDL cholesterol or good cholesterol, as well as fatty liver, are also other risk factors that we need to look for, and we look for ourselves as metabolic and endocrinologists, physicians. We do tests to look for fatty liver at the same time. So, as I mentioned earlier, what really is metabolic syndrome, or syndrome X? And literally, over the last 2 years, I think metabolic health has become radically important, especially during this period of most of us having this inertia where we don't move very much. We sit, mainly sedentarily, over the last 2 years, where we haven't been able to do much activity. There's a massive cost of not controlling chronic underlying health problems, such as above this metabolic abnormalities that I mentioned earlier: hypertension, hypercholesterolemia, high cholesterol, hypertriglyceridemia or high triglycerides, low good cholesterol, low HDL, impaired fasting glycemia, evidence of insulin resistance, type 2 diabetes, abnormal liver function suggestive fatty liver disease, or abnormal inflammatory markers such as CRP. There's massive risk factors for all diseases such as heart disease and strokes. As I said earlier, 2 to 4 times the risk. But now there's a paradigm shift towards reducing this risk of metabolic syndrome, which I think is crucial. So this lifestyle spectrum that we need to think about, I think an easy way is to think about nature and the health of what I call the sort of the biochemical system or equilibrium. Is we need to visualize some sort of spectrum with healthy lifestyle choices on one side, and then you have the unhealthy lifestyle choices on the other. Now, we could be on one side or the other, but a lot of the time, as human beings, we can't be just wholly on one side a lot of the time. We sometimes digress, we make mistakes, and we might find ourselves shuttling back and forth according to this particular spectrum between unhealthy lifestyle and healthy lifestyle, based on what choices we make every day. And I think you got to bear in mind that our real goal essentially is to spend more time on the healthy end of the spectrum, hopefully, right? So in terms of healthy lifestyle choices such as regular exercise, being active, what does that really mean, regular exercise? So I would say that something is better than nothing. If you can do 150 minutes a week or 30 minutes a day, 5 days a week of doing brisk walking, that's an ideal target. Or let's say 10,000 steps a day. If you can't get to 10,000 steps a day, you can start at 5,000 or 4,000, and you just gradually bring it up every week. So 5,000 this week, 5,500 next week, or 6,000 next week, and just gradually build it up. I think it's important to bear in mind that our mind works in that way, that anything is a good thing. So start slowly. So I would say, today you can start walking around Lake Gardens and do half an hour walk. The next week you can go hiking along Bukit Dinding or Taman Tugu or something like that, and you start moving forwards. Number 2, eating nutritious meals with a lot of fruits and vegetables, and the particular fruits and vegetables that are good. And you think about kiwis, certain legumes that are high in fiber. It's really important. Getting enough sleep is really crucial, as I mentioned earlier. 6 hours if possible, because there's a lot of data showing that if you don't have enough sleep, if you have less than 6 hours of sleep, you have a rise in this bad hormone, which is your hunger hormone, called ghrelin, and you have a reduction in your fullness hormone, which is called leptin. So you always feel you need to graze. You never feel full. You keep eating more and you get fatter. Your BMI goes up. Now, it's true. I mean, nobody's perfect. We know that. We're human after all. And of course, we're not always going to be 110% on this healthy lifestyle choice spectrum. So we might shuttle the other way. So of course, some days we work hard, we stay up too late, burn the midnight oil, do a lot of work, watch TV, eat junk food for dinner because there's too much junk food on the bench press, on the bench table, on the dinner table. So sometimes, we have food in our bag or in the car, it's junk food because stuck in traffic, or sometimes you forget to go to the to Jaya grocery store to buy some food. But it's important that we can all try to make better lifestyle choices to hopefully shift towards being healthier. And I think back to what I mentioned earlier, there are more features of metabolic syndrome. There's a constellation of multiple metabolic abnormalities such as obesity, type 2 diabetes, impaired glucose tolerance, or impaired fasting glycemia, or insulin resistance, among others. Other risk factors as mentioned here: high triglycerides, low good cholesterol or low HDL cholesterol, as I mentioned earlier, hyperglycemia, high diabetes, hypertension, and of course not forgetting fatty liver, or what we call non-alcoholic fatty liver disease. And this is the epidemiology that we're faced. The prevalence is that it increases with age, and due to greater industrialization, urbanization as well. Increase in waist circumference, which is a big factor found predominantly in women, and fasting, high triglycerides, and hypertension more common in men. And talking about gender variation, it's quite interesting that prevalence is much higher in men and women. Obese women are 13 times more likely to develop type 2 diabetes than non-obese women, even though the prevalence is higher in men. The risk of dying is much higher in women than men. Now, obese men are nearly 5 times more likely to develop illness compared with men who are not obese. And the prevalence of metabolic syndrome, especially type 2 diabetes, increases with obesity for both men and women. And among men, the prevalence is about 1.4% amongst those with desirable BMI, about 3.3% amongst overweight men, and 7.1% amongst obese men. And similarly in women, it's 1% in the desirable BMI range have type 2 diabetes, but increases 2.6% of overweight women and 5.8% of obese women. And unfortunately, this data for women, the worst thing is that they are 13 times more likely to develop diabetes than non-obese women. And that's a shocker. So you really have to be careful if you're a woman. And I think these risk factors that you can see here, being overweight, that's a very key feature. And of course, a sedentary lifestyle. These are predictors of cardiovascular events and social mortality associated with central obesity and high triglycerides, low good cholesterol, hypertension, and glucose intolerance. And aging, as I mentioned earlier, the prevalence increases as we get older. And type 2 diabetes, approximately 75% of type 2 diabetes or impaired glucose tolerance have metabolic syndrome. And it's so important, sugar is so detrimental. So many disease processes are linked to diabetes or hyperglycemia. It will make your head spin. And it literally does. It's difficult to walk each aisle of the supermarket and not develop clinical depression just looking at all the food that's available there. And actually, interestingly, starting back from way back in 2010, we've noted numerous papers from various experts in the field, some with hugely differing opinions, but we'll try to summarize it well regarding how it affects heart disease. Unfortunately, it will ruffle a few feathers along the way, but there's so many different ways to eat and be healthy, and a lot of people have put a lot of emojis with this as well. There's so many ways, but there's a lot of misinformation embedded in society. Unfortunately, it's fed by the food industry and unfortunately by pharmaceutical companies whose livelihoods really depend on the public fearing fat and living on sugar. And I think that misinformation needs to be urgently corrected, as it's literally killing us. And coronary heart disease, half of the patients' heart disease have metabolic syndrome. A third of multiple sclerosis patients have premature coronary artery disease. And there's a syndrome called lipodystrophy. It's a clinical sign that we see, which is both genetic and acquired forms of it, have severe insulin resistance and earlier death rates. So these risk factors are really crucial to look at. And there are other associated conditions as well. Heart disease, as I mentioned earlier, type 2 diabetes increased 3 to 5-fold, fatty liver, high uric acid, which is suggestive of gout, polycystic ovarian syndrome, where the prevalence is between 40 to 50%, obstructive sleep apnea, where patients, they go to sleep and their partners will notice they just literally stop breathing whilst they're sleeping. And they use a machine called CPAP, or continuous positive airways pressure machine, to help them have that continuous oxygenation through their sleep. If not, they'll feel tired the next day, they have daytime somnolence, they don't function very well. And this is associated with obesity, hypertension, and insulin resistance. And continuous pulmonary CPAP, so continuous pulmonary airways pressure, improves insulin sensitivity. So it's good to improve your metabolic parameters that we want, as I mentioned earlier. And we always live in this always on, often chaotic world that has us working long hours, sleeping poorly, stressed out, and a lot of the time eating on the run. I mean, how many of us, and I put my hands up as well, sometimes we eat in the car, and that's a bit unfortunate, because we're not able to have the time to be at home to have our food or our dinner. And this is most likely to the fact that we live in this demanding world that is chaotic, and we work, unfortunately, these huge hours, and poor sleep quality, unfortunately. And Taheri et al., and this is the evidence base that I wanted to bring into it, showed that short sleep duration, because of our chaotic on all the time world, is associated with a reduced hormone called leptin. Now, leptin is your fullness hormone, so you never feel full. You always feel you need to graze and eat and continue eating, grazing like a cow, basically. And cow's different, it has multiple stomachs, we only have one. So, and then they have another hormone called ghrelin. So ghrelin is your hunger hormone, so you always feel hungry. These two parameters lead to an increased body mass index, which is an increase in weight. And you can see this beautifully in this graph that's shown here, that if you have less than 6 hours of sleep, your average body mass index starts to go up. You start to gain more weight. The nice figure is to sleep between 7 to 8 hours, 7.5 hours. If you sleep more than 9 hours, the same thing happens. If you sleep less than 6 hours, you start to gain weight. And the parameters are here. You can see that if you have an average nightly sleep of less than 6 hours, your fullness hormone goes down. And in B, the graph B down there, if you're sleeping less than 4.5 hours, you can see definitely the graph starts to go up, where your hunger hormone starts to go up. Now, another important thing when it comes to metabolic health is the gut microbiota and weight. And there's evidence that the composition of bacteria in your large intestine, in your gut of obese patients, is very different to bacteria in patients who are lean and thin. So obese patients tend to have fewer bacteroidetes and more firmicutes than lean subjects. So bacteroidetes are the good bacteria, firmicutes are the bad bacteria. So it is possible that different bacteria extract calories differently. So some are more likely to trap energy than others. So the gut microbiota has been described as the largest endocrine organ in the body, and it plays such a huge role in our metabolic health. Okay, especially its relationship with obesity. And I cannot stress this more. When this first came out, I heard about this at a lecture at the Royal College of Physicians in London in 2010. We actually had a speaker from London, another speaker from Germany, who really illuminated us on this topic. At the time, I was only into my third year as a consultant endocrinologist, and it sort of shifted the way we were thinking about the gut. The gut is so important. We only used to focus on the insulin secreting pancreas, the thyroid gland with the thyroxine, the pituitary gland, your master seal of all hormones, the adrenal glands. Those were the main specific glands that were looked at as endocrinologists. As gynae endocrinologists, obviously we looked at the ovaries, or in men it's more of the testosterone or erectile dysfunction. But the gut by far is the most important, the largest endocrine organ in the body. Talking about diabetes, the worldwide prevalence of diabetes is increasing. Shocking. It's going to double over the next 25 years, with the vast majority of that rise occurring in the developing world. From 150 million to 300 million by the year 2025. And it's linked to this epidemic, or what I call pre-diabetes, impaired glucose tolerance. 200 million people are afflicted with pre-diabetes, and approximately 40% of these will progress to type 2 diabetes in the next 5 to 10 years. This is diabetes pandemic I'm talking about. 1 in 11 adults has diabetes. 1 in 2 adults with diabetes undiagnosed. That's the iceberg that we don't see. We only see the tip of the iceberg, just the 1 in 11. In Malaysia, we're about 18.9%, almost 1 in 5 with diabetes. And 12% of our global health expenditure is spent on diabetes and its complications. 1 in 6 births is affected by high sugars in pregnancy, what I call gestational diabetes. A lot of people ask me, what is really diabetes? Well, diabetes in simplistic terms is that when the sugar, as you can see in the schematic, is in your stomach, it's got to go somewhere. The sugars transport into the blood vessel, and the blood vessel transports the sugar, the energy source, towards the cells. Now, insulin is secreted from the organ called the pancreas in our tummy, and what it does is a transport mechanism. Okay, so the insulin, technically, as you can see here in this cartoon, is like the key that opens the door to each cell. And we have 15 trillion cells in our body. That key opens the door to allow your energy source, your sugar, to go into each cell to power it up. Now, in the world of diabetes, what happens is that key is malfunctioning. So when insulin unlocks the cell, the glucose moves from the blood into the cell to provide energy. If you have insulin resistance, which is part of metabolic syndrome, then that door is shut. The sugar can't go in to provide the energy to the cell. So type 2 diabetes accounts for about 95% of all cases of diabetes in Malaysia because of that door being shut. You have insulin resistance. So as I said, insulin resistance, this is the picture that we're having. Essentially, you're not allowing the functioning of that key, so the door doesn't open to every cell and the sugar stuck in your blood vessel. So you're not getting the sugar into the cells. So glucose, instead, what happens, it stays in your blood vessel. It damages the inside of the blood vessels, makes the surface all sticky, and other things come along and stick to it, like your high cholesterol, your high triglycerides. That's the problem. And then all the cells at the end, the organs, become unresponsive to insulin, and less sugar as such is being stored or being used. And that's the worst thing, because you have more sugar in the blood, damaging your blood vessel. That's it, type 2 diabetes in essence. High triglycerides, one of the other factors of metabolic syndrome, talking about metabolic health. A fasting triglyceride of less than 1.7 is recommended. I usually say anything less than 1, ideally. And a weight reduction of more than 10% is necessary to lower fasting triglycerides. What I normally tend to do, if I see a patient with high triglycerides, I'll just say to them, look, you're eating a lot of carbohydrate. We need to bring you in and fast you for 72 hours. And we start them on medications such as fibrate, fenofibrate, which is the drug of choice to lower fasting triglycerides. And that typically achieves a 35 to 50% reduction. Low HDL cholesterol, for rise at high HDL, weight reduction is an important strategy. Now, sometimes we use a drug called nicotinic acid, which is another currently available drug which has predictable HDL raising properties. However, it causes a lot of flushing. I rarely use it. So you've got statins, fibrates, a tablet I use a lot called pioglitazone, which I did research on it back in 2004 2004, 2007. So I think LDL cholesterol by far is the one that we're all focused upon. And anybody with the metabolic syndrome with diabetes, LDL cholesterol should be reduced to less than 2. Talking about blood pressure, now there's a huge relationship between blood pressure and all-cause mortality rate. The higher blood pressure, the higher risk of death, especially death from heart attacks and strokes. Now, I always find that the best choice as an endocrinologist, the first blood pressure tablet should either be a particular tablet called ACE inhibitor or an angiotensin II receptor blocker. Huge evidence behind this. And in patients with hypertension, think about as low as possible sodium restricted diet. So low salt diet, yeah, higher fruit intake, vegetable intake, low fat dairy products should be advocated as well. My ex-boss, who was my mentor, Professor Brew Atkinson, he was involved in research where he had patients who technically, this was a hypertensive patients. One group of patients were restricted salt completely. So in other words, they had food delivered to them from Tesco's, which they had to cook with no salt on the table or no salt in the cooking. The other group, they had no salt restricted diet, but they had to take a blood pressure tablet. After about 24 weeks, the results on blood pressure was the same in each group. So therefore, it showed that a sodium restricted diet can be as good or similar in efficacy to taking a certain type of a blood pressure medication, namely a thiazide diuretic. So what's important is that we need to build a more resilient body. But unfortunately, our modern lifestyle stresses out our body. And the more times we make unhealthy choices, the more that stress compounds. So how can we help our body build a better resilience to handle that, what I call that stress? Now, sometimes it turns out the opposite is also true. So the more times that we make a healthy choice, the more resilient our bodies become. I call that the legacy effect. So for example, if you get 3 to 4 hours of sleep one night, you're not going to feel great the next day. But as long as you get enough sleep the following night, you'll be fine. But if you get 3 to 4 hours of sleep for a week, a month, it's really hard to bounce back or recover from that. Happens to a lot of people who are involved in night shift work. And they are high risk of insulin resistance as a result. So this resilience, and in fact, or should I say the lack thereof, is also reflected in our body's biochemical parameters. So I think benefits of better control, think questions like, will I be able to live longer? Will I have less complications? As I said earlier, it's all about this legacy effect. So modifying lifestyle, less of dietary drinks such as fizzy drinks, reduction in calorie restriction, lifestyle modification towards eating more legumes, more greens, more fibrous vegetables, and again, as I mentioned earlier, healthy exercise. And as I said earlier as well, something is better than nothing. Now you can talk about diet, you can talk about a 500 kilocalorie diet restriction, which equates about a weight reduction of 1 pound per week. Now, diets restricting carbohydrate typically provide a huge, quick, rapid initial weight loss, and it kind of stops. So adherence to diet is more important than which diet is actually chosen. And to me, a high quality diet enriched in fruits, vegetables, whole grains, lean poultry and fish should be encouraged, and that will provide the maximum overall health benefit. Now back to that question, what can I eat? And is sugar the culprit? And really, sugar is so detrimental, as I mentioned earlier. It is the culprit because huge number of disease processes are linked to it, and I think that's why it's important to eat healthily, as I mentioned earlier, and we need to change the mindset, like a paradigm shift from this misinformation where the public fears fat about eating and sugar, especially in our society in Malaysia. We don't eat like a Mediterranean diet. This misinformation needs to be urgently corrected because we're eating too much roti canai, too much of nasi lemak, and too much of paos, and too much of sweet stuff, noodles, kway teow, and that needs to be changed. And talk about everything has to be in moderation, as I mentioned earlier. Not huge big packs, but smaller portions. If you have a dinner plate, Don't use a dinner plate, use a dessert plate. When you use a dessert plate, you're able to control your portion size. Even if you can go to Tesco's, get one of those plates that have 1/4 is your, that much is your carbohydrate, 1/4 is your protein, which could be something like ayam bakar or ikan bakar, something that's steamed or grilled. And then the other half is your vegetables, not like here, which is we're talking about a huge burger, per se. So low GI foods, really important. Pumpernickel bread, try and find that bread. I think it's really important to have, sourdough bread with pumpernickels, which is basically lots of seeds in it, which slows down the absorption of that carb, and your sugars doesn't rise up like that, but it rises up in a really plateau fashion. Fruit nut mix instead of a Mars bar, all bran instead of like cornflakes, and your own unprocessed orange juice that you distill yourself at home, and you're able to crush it yourself, and you pick up all the fiber from the bottom and put it back into the cup, because that slows down the absorption of the sugar as you eat it. Physical activity, this is the important part. 60-90 minutes of daily activity. I would probably say 30 minutes is good enough, and that's 150 minutes a week. Gradually bring it up, and that will enhance adherence, per se. You can swap between walking, brisk walking, skipping, hiking, jogging. If you've got bad knees, you can go swimming. Some high risk patients should undergo what I would call a formal cardiovascular evaluation before initiating like HIIT exercises, spinning classes, and physical activity such as jogging, swimming, tennis, or even simple stuff, routine activities. I call movement. Movement is a very good physical activity. You just need to move around the house, from one end of the wall to the other. A very good Scandinavian study was shown during this MCO period, where moving from one wall to the other of the condo or the flat reduced insulin resistance. So gardening, walking, house cleaning, activity that helps the house basically is good. So good metabolic health has a protective effect. Metabolic health is not only impacted by what we eat and our physical activity, it impacts on how our body responds to these lifestyle factors. So good metabolic health, greater metabolic flexibility. And if you have a habit of incorporating all these lifestyle choices into our lives, that will allow us to have a better metabolic health parameters. As I mentioned earlier, better metabolic health parameters, which is lower cholesterol, lower triglycerides, lower blood pressure, lower blood sugar, lower body mass index, less risk of fatty liver, et al. If someone ate a lot of food that had a lot of sugar in it, that sugar is absorbed into the bloodstream, and it triggers, unfortunately, the insulin to take it up into the cells. In a person who's metabolically healthy, a normal blood glucose response will be like that purple line on the graph. It has a slight increase and it just plateaus. It has a small impact. But unfortunately, if someone is not metabolically healthy, which happens in patients with diabetes or pre-diabetes or impaired glucose tolerance, and they make consistently poor lifestyle choices, a lot of carbohydrate, a lot of noodles, or should I say kway teow, their response would look like the one in the red line. The sugars go up much higher and it takes a lot longer to return to that baseline, if they do at all. So a lot of our patients tend to have sugars rising up to the teens, 15, 16, 20s, when normal blood sugar should be between 4 to 7. So what this means is that someone who's metabolically healthy has greater metabolic flexibility and metabolic resilience. So good metabolic health has a protective effect against poor choices. So it makes us more resilient, but also less risk of having end organ damage to your liver, which is fatty liver, damage to your kidney, which is kidney disease, damage to your heart and your brain, which means stroke and heart attacks. So it's really important to be metabolically healthy as much as you can, so that you worry less about the lifestyle factors that are out of control. And last but not least, this is my own particular message, which I give to my patients. I call it my rule of 8s. Very simple to remember. 8 being an Ong number, lucky number, especially now after the Chinese New Year. 8,000 steps a day, easy enough to remember instead of a 10,000 if you can't get to there. Eat before 8 p.m. because you need at least 4 hours in between your last meal and your sleep. Because if not, you'll not be able to metabolize the sugar that you've eaten. It will be stored either in your fat tissues or in your bloodstream, damaging your blood vessels. Sleep ideally 8 hours a day. Anything above 6 is great. 7.5 to 8, fantastic, because that will reduce your hunger hormone and increase your fullness hormone. If you sleep less than 6, you're gonna get hungrier. You'll be grazing all the time. You start to gain weight. But drink at least 8 glasses of water. This is a very good advice, which I think a lot of us tend to miss. Hydration is really important at all times for the functioning of all organs, especially our kidney. We are 70% water after all. And most important, last of all, and this is something that always Tun Mahathir would always profess whenever he talks to the public, what his late mother used to tell him: stop eating before you're full, or stop eating when you're 80% full. I think that is an advice that we all should take to heart. And with that, I would like to thank you all for giving me the time to listen to my talk, and I hope you have a great day ahead in this particular set of lectures. Thank you very much.